Welcome to this insider tour of the Gynecare TVT ABBREVO procedure. This animation highlights key steps for performing this inside-out transobturator surgery for female stress urinary incontinence. First, the patient is positioned with the tip of the coccyx flush with the edge of the table and in high lithotomy, which is 90 degrees from the table. During the time of the needle pass, the patient's position should be adjusted to hyperflexion, or 110 to 120 degrees from the hip. The reference points of the trocar passage are 2 centimeters anterior to the level of the urethral meatus and 2 centimeters lateral to the groin crease. The helical passes should not exit any more lateral from these marks. Next, the vaginal incision is made. Then the dissection is made laterally towards the ischiopubic ramus. The winged guide is inserted into the dissected tract, posterior and in contact with the ischiopubic ramus, and into the obturator internus muscle. Neither the scissors nor the winged guide should perforate the obturator membrane in this procedure. The helical passer is then inserted along the track on the winged guide. Gentle force is applied on the back end of the helical passer until it pops the obturator membrane. When this happens, a loss of resistance is felt. Once the obturator membrane has been perforated, the winged guide is removed and the handle is dropped to 90 degrees with the horizontal, nearly vertical to the floor. As the helical passer is rotating, it should stay as medial as possible in contact with the ischiopubic ramus. The helical passer should be fully rotated until the tip of the helical passer sheath appears at the skin. Once the helical passer has punctured the skin, the tip of the helical passer is grasped with a hemostat. Then the helical passer is removed with a reverse rotation of the handle. Next, the helical passer sheath is pulled completely through the skin until the plastic sheath and positioning lines appear. It is important at this point to make sure the plastic sheath is not twisted. The passage is then repeated on the patient's other side. After dissection, the winged guide is inserted, followed by the helical passer. The winged guide is removed and the obturator membrane is perforated with the helical passer. The handle is dropped to the midline and rotated until the helical passer punctures the skin. The helical passer is removed and the plastic sheath is advanced by pulling on the helical passer sheath. Then, the helical passer sheath is pulled gently through the skin until the plastic sheath and positioning lines exit the skin. The mesh is positioned by pulling the plastic sheath out through the membrane laterally. The helical passer sheaths are then cut from the plastic mesh sheaths. A blunt instrument is placed between the urethra and the mesh before making tensioning adjustments. It is important to grab both the plastic sheaths and the positioning lines to adjust the mesh. Once the mesh is adjusted, the plastic sheaths are removed by grasping the plastic sheath with a hemostat. The blunt instrument is still in place to apply counter-traction on the mesh, while the plastic sheaths are removed by pulling them laterally towards the leg. The positioning lines are removed by gently pulling on one end of each of the positioning lines. Then the placement loop is removed by cutting the proline stitch that attaches the button. Finally, the vaginal and skin incisions are closed. This concludes the Gynecare TVT ABBREVO procedure.